Thank you. And now, I turn this over to my colleague Scott Peters in California.
Thank you, Peter, and thanks everyone for coming. I represent San Diego, Coronado, and Poway, California, and the people in those communities elected me to come to Washington to do something. I often say I don't come to Washington, D.C. for the weather. I'm from San Diego. And so I'm very, very frustrated. I was very frustrated to sit through a 27-hour hearing in the Energy and Commerce Committee where the whole thing was pre-cooked, where Democrats weren't invited to be part of the process. And I'm particularly irked to hear people say Democrats aren't willing to work with Republicans, because that is absolutely not the case. So today we're bringing solutions that would deal specifically with issues we all can agree we should work on to make sure that Americans across the country aren't facing higher premiums and the loss of coverage. I focused on three particular things, and I want to just give you a couple of numbers to see what this means for Americans who are fighting out there to make ends meet. On the individual mandate, we need some way to get young people into the pool. If you don't want the individual mandate, there's other things we can do to encourage that. But without the individual mandate, without the mechanism to get younger people in the pool, premiums in 2018 and 2019 are projected to increase 15% to 20% higher than they otherwise would. We need to act on that today. On reinsurance, we've got to stabilize the markets to deal with high-cost medical problems. As applied by the Affordable Care Act, the transitional reinsurance program helped reduce average premiums by 10% to 14% in 2014. We need to reestablish that program to keep premiums down. And finally, the Kaiser Family Foundation found that eliminating the CSR payments, the subsidy payments, would cause government spending to increase by $2.3 billion per year. No Republican or Democrat would stand up and say that that's a good idea. So what we're trying to do today, and I think we will do, is as we watch Republicans lose their battle among themselves on health care, there's a bunch of Democrats here up on stage, and I think there's more, who want to work constructively to solve these problems and to deal with issues that should have no partisan disagreement, things we should all agree on we should do for American people to keep premiums down, keep people insured, and give them a chance to fight in this economy to feed their families and make ends meet.